I'm Dr. Stacy Ripke, and for today's 3-Minute Mondays, we are here on the steps of our nation's capital. We've brought students from across all programs and class years here for our Global Healthcare Leaders Washington, D.C. program. So come along with us. This Global Healthcare Leaders trip here to DC is absolutely amazing. Our students are learning from the best of the best in the world of advocacy and policy change. And they're taking that information to the Hill, where they're meeting with congressional leaders about the oral health landscape. And it is so incredibly important for our students to have an understanding of how to advocate for their patients when they go out into practice. So I'm over the moon about what they're learning, what the takeaways are, and it has just been an incredible journey.
This program is about leadership, and it's about advocacy and the importance of every leader becoming an advocate. No matter what you're going to do in a leadership role in the profession or in your community or whatever it may be, you're going to need to advocate on behalf of the people that you hope are going to follow you.
They brought us here today to Capitol Hill to advocate for both the special needs population and the veterans who have fought to keep us safe. And me personally, having patients in both the special needs clinic at NYU and treating veterans, it's very rewarding for them to come in and tell me the difficulties that they've gone through to get oral health care. And now I'm able to go back and tell them, I heard you and I fought for you.
I'm thrilled that the Dental Leadership Scholars are able to come to DC for this trip. I hope our students, when they graduate from NYU and they open up their dental practices, they continue advocacy. They take some of the issues that they learn about in their dental office, some public policy issues that are important to dentists and their community, and they now are comfortable coming to DC to advocate for policies that can impact their practices and community.
It means the world to me to be a part of this program, to have the opportunity to talk to congressional representatives about oral health care.
We are so excited to be here at the Capitol to translate what we see in the clinic to the real world and see how what we experience will affect policy in the future.
I count it as a privilege, having that sense of responsibility of giving back to community, especially part of the population that definitely needs to be heard when it comes to access to oral health care.
Being here at the Capitol and advocating for these marginalized groups, I do think it's laying the groundwork for future populations to have a better outcome and to have better access to oral health care.
We just had an absolutely amazing day being able to meet with different congressional staffers in Washington, D.C. I can't believe that as dental students we were able to have an experience like this. I'm so glad that we were able to take advantage of it, and I can't wait to see what happens in the future with oral health care legislation and how we can be a part of it.
It was really enriching experience. Coming from a different country, I learned how Congress works in the United States of America, and we truly are global health leaders.
It truly has been such an honor and privilege to be part of this leadership program. The last couple of days have been so inspiring, and this whole trip will be so memorable.
It's also very educating. I feel like this is a lot of the information that we receive in classes, like health promotion and disease prevention. So it's really fun, and it's been very inspirational to be able to see it in person and act upon it as well.
This program is all about impact through advocacy. And by partnering with NYU's Global Academic Center here in Washington, D.C., taking our students to Capitol Hill and into the halls of Congress, we know that they are making an impact today, and we hope this experience will make them excited and motivated to continue this kind of work into the future. That's it for today's 3-Minute Mondays, and we'll see you next week.